Hi everyone, welcome back. Today I will be talking about CMS final rule for home health prospective payment system for the calendar year 2022. Let's get right into it. On November 2nd of this year, the Centers for Medicare and Medicaid Services or CMS acted to improve home health care for older adults and people with disabilities through a final rule that would accelerate the shift from paying for Medicare home health services based on volume to a system that pays for value. The rule finalizes a nationwide expansion of the successful home health value-based purchasing or Hhvbp model and makes updates to the Medicare Home Health Prospective Payment System or PPS and the Home Infusion Therapy Services payment rates for calendar year 2022 in accordance with existing statutory and regulatory requirements. This final rule makes permanent the changes to the home health conditions of participation or COP that were implemented during the COVID-19 public health emergency or PHE and finalizes changes to the conditions of participations to implement the provision of the Consolidated Appropriations Act 2021. This rule also finalizes changes to the Home Health Quality Reporting Programs or QRP. First of all, I will talk about Home Health Value-Based Purchasing or Hhvbp model expansion. Under the authority of Section 1115A of the Social Security Act, the CMS Innovation Center or Innovation Center implemented the original Hhvbp model on January 1, 2016. This model tests whether payment incentives can significantly change healthcare providers' behavior to improve quality of care through payment adjustments based on quality performance during a given model performance year. The Hhvbp model's current participants provide services in 9 randomly selected states and comprise all Medicare certified home health agencies providing services in Arizona, Florida, Iowa, Maryland, Massachusetts, Nebraska, North Carolina, Tennessee, and Washington. The evaluation findings showed that participants' performance from 2016 to 2018 achieved an average 4.6% improvement in quality scores as well as average annual savings of $141 million to Medicare. The CMS Chief Actuary's certifications and determinations made by the Secretary designated the Hhvbp model as eligible for expansion nationwide through rulemaking. On January 8 of 2021, CMS announced its intention to expand the model no earlier than January 1st of 2022 through notice and comment rulemaking, and a proposal for nationwide expansion was included in the calendar year 2022 Home Health Prospective Payment System proposed rule. Given this expansion, CMS is also ending the Hhvbp model for participants in the original model's 9 states. The first performance year of the expanded Home Health Value-Based Purchasing model will be calendar year 2023, with quality performance data from that year used to calculate payment adjustments under the expanded model in calendar year 2025. Throughout 2022, CMS will provide technical assistance to home health agencies to ensure they understand how performance will be assessed as finalized in this rule. Calendar year 2022 payment updates and policy changes updates for home health agencies and home infusion therapy suppliers. The final rule updates calendar year 2022 Medicare home health payment rates and the wage index for home health agencies in accordance with existing statutory and regulatory requirements. CMS estimates that Medicare payments to home health agencies in calendar year 2022 would increase in the aggregate by $570 million or 3.2%. The $570 million increase in estimated payments for calendar year 2022 reflects the effects of the calendar year 2022 home health payment update percentage of 2.6% or $465 million increase, an estimated 0.7% increase that reflects the effects of the updated fixed dollar loss ratio or 125 million increase, and an estimated 0.1% decrease in payments due to the changes in the rural add-on percentages for calendar year 2022 or $20 million decrease. Recalibration of patient-driven groupings model or PDGM case mix weights. Each of the 432 payment groups under the PDGM has an associated case mix weight and low utilization payment adjustment or LUPA threshold. CMS's policy is to annually recalibrate the case mix weights using the most complete utilization data available at the time of rule making. In this final rule, CMS is finalizing the recalibration of the PDGM case mix weights, functional levels, and comorbidity adjustment subgroups while maintaining the calendar year 2021 LUPA thresholds for calendar year 2022 to more accurately pay for the types of patients home health agencies are serving. Occupational Therapy LUPA Add-on Factor. Division CC Section 115 of the Consolidated Appropriations Act of 2021 included provisions to allow occupational therapists or OTs to conduct initial and comprehensive assessments for all Medicare beneficiaries under the home health benefit when the plan of care does not initially include skilled nursing care but includes either physical therapy or PT or speech language pathology or SLP. Because of this change, CMS is finalizing conforming regulation text changes for this provision. Since OTs can now conduct the initial and comprehensive assessment, CMS is establishing a LUPA add-on factor for calculating the LUPA add-on payment amount for the first skilled occupational therapy visit in LUPA periods that occur as the only period of care or the initial 30-day period of care in a sequence of adjacent 30-day periods of care. Currently, there is insufficient data regarding the average excess of minutes for the first visit in LUPA periods when the initial and comprehensive assessments are conducted by OTs. Therefore, CMS will utilize the physical therapy LUPA add-on factor as a proxy until calendar year 2022 data is available to establish a more accurate occupational therapy add-on factor for the LUPA add-on payment amounts. Updates to the home infusion therapy benefit for calendar year 2022. CMS is updating the home infusion therapy services payment rates for calendar year 2022 as required by law. In addition, CMS is updating the geographic adjustment factor used for wage adjustment and to maintain the percentages finalized in the calendar year 2020 Home Health PPA's final rule with comment period for the initial and subsequent visit payment policy. The overall economic impact of updating the payment rates for home infusion therapy services is expected to be an increase in payments to home infusion therapy suppliers of 5.1% based on the percentage increase in the Consumer Price Index for all urban consumers or CPIU reduced by the productivity adjustment for calendar year 2022. The Consumer Price Index for all urban consumers or CPIU for the 12-month period ending in June of 2021 is 5.4% and the corresponding productivity adjustment is 0.3%. Home Health Quality Reporting Program updates. The Home Health Quality Reporting Program or Home Health QRP is a pay-for-reporting program for home health agencies that report quality data to CMS. Home health agencies that do not meet reporting requirements receive a 2 percentage point reduction to their annual market basket percentage update for that calendar year. This rule improves the home health quality reporting program by finalizing several proposals, including removing an OASIS-based measure that is no longer demonstrating meaningful differences in performance and replacing two claim-based measures with a new claims-based measure that addresses concerns raised surrounding attribution and is more strongly associated with desired patient outcomes. In supporting the coordination of care, CMS is finalizing its proposal that effective January 1, 2023, home health agencies begin collecting data on the transfer of health information to provider post-acute care measure, the transfer of health information to patient PAC measure, as well as 6 categories of standardized patient assessment data elements effective January 1, 2023. Fast Healthcare Interoperability Resources or FHIR in support of digital quality measurement and quality reporting programs. CMS is working to further the mission to improve the quality of healthcare for beneficiaries through measurement, transparency, and public reporting of data. CMS believes that advancing its work with use of the FHIR standard offers the potential for supporting quality improvement and reporting, which will improve care for its beneficiaries. CMS received feedback on its future plans to define digital quality measures or DQMS for the home health quality reporting program. CMS also received feedback on the potential use of FHIR for digital quality measures within the home health quality reporting program, aligning where possible with other quality programs. CMS is currently analyzing the feedback received for future consideration in program development and future rule making. Home health conditions of participation. CMS is finalizing policies that makes permanent current blanket waivers related to home health aid supervision and the use of telecommunications in conducting assessment visits. CMS issued these waivers for Medicare participating home health agencies during the COVID-19 public health emergency. While CMS is finalizing the limited use of telecommunications technology when performing the 14-day supervisory visit requirement when a patient is receiving skilled services, CMS expects that in most instances the home health agencies would plan to conduct the 14-day supervisory assessment during an on-site in-person visit and that the home health agency would use interactive telecommunication systems option only for unplanned occurrences that would otherwise interrupt scheduled in-person visits. CMS is also updating the home health conditions of participation to implement Division CC Section 115 of Consolidated Appropriations Act 2021, which requires CMS to permit an occupational therapist to conduct the initial home health assessment visit and complete the comprehensive assessment under the Medicare program, but only when occupational therapy is on the home health plan of care with physical therapy and or speech therapy and skilled nursing services are not initially on the plan of care. On this slide, I have listed the reference that was used to create the content of this presentation. If you enjoyed this video, please do not forget to subscribe to my channel. Thank you for joining me. See you next time. Bye now.